That would be by the end today. I'm going to be giving a colonoscopy to somebody. This is something that I felt like doing at 1:14 in the morning. So just why not? It's something I wanted to do for a long time, and I'm finally getting to do it.
Hello, and welcome to Surgery Squad's virtual colonoscopy.
Yeah.
Also known, our patient is lying on her
right,
left side, knees drawn up to her stomach. She's wearing a gown, and we have a sheet draped over her. Let's set her up with an IV drip of the sedative.
Okay. Gotta wipe that off first. Shit, man. Why did it make her more white? And they're not gonna give her any numbing shit. Oh my god. No numbing shit.
Great. Now we'll wait a few minutes for the sedative to take effect.
Okay.
Our patient is sedated and ready. She stated that she's cleansed her colon, and I've already used a lubricated, gloved finger to check for blockage.
Damn right.
Be sure to tell the patient that she should breathe slowly through her mouth to relax her stomach muscles if she feels cramping. We'll insert the endoscope into the anus and slowly move it into the colon. The endoscope contains a small camera and light, and a pair of forceps so we can remove any polyps we find. First, let's lubricate the scope for easy insertion and passage through the colon.
Okay. Oh yeah, baby. Gonna lube that all up. Oh god, I did a horrible job. No, I did an okay job. There you go.
Carefully insert the scope into the patient's anus and slowly move it into the colon.
I'm sorry, but you just
We can watch the camera's output on the monitor.
God.
We're into the rectum now. Nothing so far. Let's move on into the sigmoid colon.
Why?
Slow and steady. You're doing a great job. Descending colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam.
Why? Why?
All right, let's move into the transverse colon.
Could you imagine they didn't actually clean their fucking colon? There's just a big thing of poop
Uh-oh,
in there.
looks like we've got a small polyp in the transverse colon.
What the fuck is a polyp?
We'll use the forceps to remove it.
Good. Okay.
Fine work. We'll need to remove the scope so we can bring the polyp out. First, let's use some heat to cauterize the spot and try to stop that bleeding. Fantastic. Let's slowly withdraw our scope and get that polyp out. Let's go back in to check the rest of her colon.
Okay, let's do it.
Remember the name of the colon where we found the polyp?
Nope.
That's right, the transverse colon.
Fucking hell. Okay. I guess we're doing this again. Oh shit. Are we gonna see the Why is this taking so long? What the fuck are these sound effects? Do you hear that? It's like Ugh. Why is this taking so long? Just stick it in.
Back in the transverse colon now. Everything's looking fine, and you're doing a great job.
Oh, thank you.
Now's also a good time to remind our patient to breathe through her mouth slowly.
Okay, you already
Moving now
said
into
that.
the ascending colon. And there's another one. Let's take it out the same way we did the other.
What the fuck is a... Here, I gotta look this up. In zoology, blah 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 blah. How about in the anus? There we go. No? Yes. Oh god, yes. Mucous membrane? Okay. Okay, oh yeah. Shit. You know, I can see
Back in the
myself
ascending
doing this.
colon now, and we move into the cecum. And all looks good. Let's take out the scope and get our patient into a recovery room. Our patient is now in recovery, and she'll probably be there 1 to 2 hours. She might feel bloated or need to pass gas. And since we removed 2 polyps, she'll probably have a small amount of blood in her stool. We'll also do a biopsy on the polyps. She should call her doctor immediately if she has heavy rectal bleeding, lower abdominal pain, develops a fever, feels dizzy, vomits, or experiences swelling in her abdomen.
No.
Well, good news. The biopsy showed our patient's polyps were benign.
Carpal tunnel release. Oh, I might have to get this. No, I'm kidding. I probably don't. Maybe. I mean, carpal tunnel of love, maybe. If you get that reference, I want to marry you. No homo.
Welcome to Surgery Squad's virtual limited open carpal tunnel release.
Okay, right here.
The limited open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist.
Okay.
If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic.
That would be amazing.
Go ahead and get the operating area numb.
Oh, okay, there we go. Oh my god. Oh, that's disgusting. Why is it all like, ew?
With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be making our incision?
There's 2 places in the body where I'm so sensitive and, I hate thinking about surgery there. And it's my eyes and, my palms, my hands. And it's just so gross. I'll do the eyes next. Yeah. Baby, a triple. Continue.
Looks good to me. We'll be making a 3/4-inch incision at the intersection of those lines. Now take the scalpel and make the incision.
Great. Here, I want to go over here. No, I'm kidding. There we go.
Nice. I couldn't have done it better myself.
Yes, you could.
Now we'll spread the incision wider to expose the transverse carpal ligament.
Okay.
This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open.
Fucking hell.
I think you're a natural at this.
Hell.
With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision.
Really?
This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament, and is used to protect the underlying nerve and tendons.
Whoa!
Go ahead and push the carpal tunnel guide into place.
Oh my god! Oh my god! Oh my... No! Why? Oh, fuck!
Once it's in position, you'll advance our special knife down the guide to split the carpal ligament.
Whoa!
Push the knife forward, cutting through the carpal ligament.
I don't want to do it. Okay, but I will. Holy shit.
Perfect. With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision.
Then what the fuck is this other line?
Go ahead and irrigate the wound.
Okay.
When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great. Now you'll close the wound using non-absorbable sutures.
Fuck. We doing fucking backflips over her.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Okay.
And lastly, we'll place a small dressing over the wound to absorb any residual blood. We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover. Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist.
Great.
Once our patient returns home, he'll be asked to follow specific instructions for driving, exercise, and medication. This will include keeping his hand elevated above his heart for the first few days after surgery. About 2 weeks after surgery, we'll remove our patient's stitches, and he'll be gradually allowed to return to his normal routines in 4 to 6 weeks. And that's a limited open carpal tunnel release surgery. Thanks for stopping by.
Nail.
Why not try out...
Oh, baby. Oh, shit. Oh, my God. Oh, my God. Oh, this is gonna be so sexy. Fuck. You know...
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I will be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail.
Let's just get
Our patient is ready, so let's begin by disinfecting the toe.
Okay. Why is it all red? What the fuck? Here, I'm just gonna do like the entire fucking foot. With the doctor just iodine. Are you serious? Oh, it's iodine. That's why it's red. Oh, you shouldn't really get this on your skin, though. Well, that sucks. There you go.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Okay. How about right... Yeah, I'm gonna fucking insert that fucking needle all the way into the fucking toe.
Great. Now we'll wait a few minutes for the toe to get numb.
Damn, that's my jam, motherfucker. Why do I keep saying motherfucker? I need water.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound.
That's so much better.
Once you've done that, we can... First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Do you know how much this would hurt, like, afterwards, though?
Great. Take the forceps and carefully remove the ingrown nail.
Oh, great. Oh. Ew.
It's getting kind of messy in there. Let's clean up that blood.
Okay, if you say so. God, this guy must
See that small bit of pale yellow substance right there?
No, I don't want to.
It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe.
I swear to God, if... Oh my God. Oh.
That toe is starting to look much better, but we're not done yet.
Great.
Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem... When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
You motherfucker.
Finish by applying some antibiotic ointment. Place it against the toe and wrap it in a gauze bandage.
Oh, great.
Fantastic job.
Fantastic job.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day.
2 to 3
While our
times.
patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
That's what I'm going to do. Cosmetic, Botox. Oh, fucking Botox and set. Wait, tattoo removal. Okay. This is my last one, though. Like, seriously. I can't take this anymore. I just picked the non-gross one. I picked the non-gross one. So, we won't have much trouble.
Welcome to Surgery Squad's laser tattoo removal. I'm Dr. Susie, and I'll be assisting you with this procedure today.
How you doing, motherfucker?
According to a recent poll, over 50% of those with tattoos. Before we begin, we need to go back in time to the day he picked out his tattoo. Help him pick out a real winner. Use the arrows to scroll through the tattoos. Click Choose when you have made up your mind.
This is actually kind of cool. Yes. So they gave him a tattoo for the sake of this video.
Yikes! She doesn't really look like that, does she? Let's make that tattoo disappear. During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time. So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
Instant chill pack. Ooh. Jeff's. Oh, fuck. It's a reference. Oh, and I can...
That will do.
I can select the...
Now we need to use the laser to fade the tattoo.
Fuck.
Different types of lasers react with certain colors of tattoo ink.
So it's a
One laser
bitch.
might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result.
Okay.
To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
Okay. Princess bitch. Red or orange? Okay, I think that's it.
Next up is green, blue, or other darker colors.
Oh, so like the rest of this. Or not.
Finally, we'll remove the black.
Okay, I guess black is not a darker color. Whatever. Logic. Are we good? Okay, we good.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area.
Okay. Instant chill pack. Okay, I stuck the tag.
You did great. Our patient is ready to go.
Yes,
Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected.
Oh,
roll the bandage over the treated area. As stated earlier, our patient's tattoo will only begin to fade after multiple treatments. So he shouldn't expect the tattoo to... Before we begin...
Okay, I want to see...
Before we begin, we need to go back in time to the day he picked out his tattoo.
Here.
Help him pick out a real winner.
Oh my god,
use the arrows to scroll through the tattoos.
Penis.
Click choose when you have made up your mind.
Penis. I can't think of a better thing to put than penis. Penis, vagina, cunt, bitch. Ah, damn it. Wait. Penis, vagina, cunt, bitch. Okay. Wait. Penis, vagina, cunt. Hold on, I'll come back to it. Yeah, that's it. Choose. Okay, I want to do this.
Interesting choice. The heart's a nice touch. Let's make that tattoo disappear. During our patient's initial consultation, it was recommended that he take a lot of pain. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals.
Right,
if our patient fails to do this, both
braces,
his recovery...
Okay. You know, I got braces done a week and a half ago. And it hurt like shit. I mean, it hurt so fucking bad. You don't even know. Why am I doing this? This is taking up 20 minutes at 1:30 in the...
Welcome to Surgery Squad. I'm Dr. Jeff.
Place number. Oh, preparation.
Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Okay. Oh shit, I had to get something similar to this done. Beep, beep. But they had like this big ass
Next,
that came
we'll take
all
an impression
around
of the teeth. We put a special gel on the bite mold.
But I did it.
The
like
gel
when
comes in lots of terrific
10.
flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
I can put more than just the mold in the mouth. Yeah.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth.
I want to take that home.
We've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
Oh, I guess I could have skipped. Yeah, one leg later, bitch. Let's go.
Our patient is back, and we're ready to put on her braces.
Whoa, 1
In
week?
some
It took
cases,
me like 5
a patient
years.
may need spacers placed between the teeth for a week to create more room for the bands.
I got those,
Our
and they were
patient does not.
so
We'll start by
fucking
polishing all the teeth.
annoying.
Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Okay. Oh shit.
Wow!
Okay.
What a marvelous job. I can almost see myself in those teeth.
Well,
We need to
I didn't
put on
mean
some
to
molar
skip
bands
or
to
whatever.
anchor the braces. They circle the whole tooth and have a hook on the outside of the
I
tooth.
do not have these.
Slip the molar band over the tooth. We'll cement it into
I don't
place
have
later.
these. Okay. I don't know why they don't do that back teeth, like the fucking wisdom tooth.
Great. Now we can start putting the bonded brackets on the rest of the teeth.
Why don't I have?
We've placed a
the
lip
molar
guard
for
over the
that?
teeth to give us room to work.
I didn't
Let's
get
rinse
that
off
either.
the teeth. Can you spray them with water?
Yeah,
I run the suction to
sure.
remove the
I
water.
had to get water, and then I had to get like a bunch of water. Yeah, I'm just gonna flood this fucking patient's mouth. Oh, low
Let's spray
quality
some
sound.
air to get the teeth nice and dry.
.jpg.
Can you handle that for me?
Sure. They were dry, constantly drying and sucking up all my
With the
spit
teeth
and
dry,
shit.
we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Wipe a little bonder on each one. Here, let me see how fast I can click this. My teeth are my
We
bottom
let the
row is,
bonder
like, more
dry for a
fucked
minute
up.
or
Like,
two
this
so that
tooth
it is
like
sticky.
back all the way
Then we
down,
place
like,
a
the
bonded
bottom of my
bracket
throat.
onto it.
What? It took like half an hour. Yeah.
I will scrape off the excess
Okay,
bonding
what the
agent with a
fuck
dental
are
pick.
these? What are
Now
these,
use a
like,
curing
things
light to
sticking
harden the
out?
bonding agent under the brackets.
They're so
Click to turn on the
annoying.
curing light.
Yeah, what is this? Like, they were like doing this shit. Yeah, I'm not doing it to each teeth.
Great job. Now I'll put the bonded brackets on the rest of the teeth.
Whatever.
There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the
Good
arch
for you.
wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth
For mine,
to
they
put it in
just put it
place.
here and here, and then they just like whatever the fuck.
Good job. We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try.
Okay.
Place the ligature over the brackets indicated.
Oh. Pretty sure it doesn't go as fast. They have to like snap it into place, and then it like they put pressure on your teeth, and then it hurts like shit. Oh, come on, there we go.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the...
Yes. Yes. Okay, and this has to be the last one I do, guys. Oh my... Yes! I saved the best for last. I swear to God, this is my last one. I mean, these are so fun. They're fun as fuck. But this has to be my last one.
Welcome to Surgery Squad's
To begin the surgery, we need to start. While some anesthesiologists may prefer to give a patient a general anesthesia, the incisions for breast enhancement surgery may be made under the breasts, around the areolas, or under the arm. For this procedure, we'll make the incision under the crease of each breast. This area leaves little noticeable scarring. Now sketch where we'll be making our incisions.
Just drawing on a woman's breasts. Dream job right here. Yeah, whatever.
Let's use the scalpel and make the necessary incisions so we can insert the implants. Our patient has chosen silicone gel-filled implants because they have a more natural feel.
I actually chose them.
We'll have to make a slightly longer incision in order to insert the implants.
God, I wonder why she didn't buy
this is due to the implants being full when inserted, as opposed to saline implants, which can be inserted empty. With our incisions made, we'll now make room for the implant. To do so, we need to slide a finger into the incision and gently sweep it back and forth to separate the pectoral muscle from the ribs.
Perfect.
Using a finger is gentler than a metal instrument and lessens the chance for damage to the nipple's nerves. Can you slide your finger into the incision and move it back and forth to create the pocket for the implant?
Can you slide your finger into the fucking breast? Oh. Oh, look at that. Fucking hell. Okay. Oh my god, it's going all the way fucking behind there. I mean, I wouldn't know what this feels like. looks painful.
Now we carefully insert a retractor and cauterize any muscle groups still attached.
Oh god. What was that? What is that sound? There's a little bit of spit on my monitor. I have to wipe it off.
Nice job! Now we need to prepare the implants. Breast enlargement is achieved through the placement of a silicone pouch called... With our incisions made, we now need to slip the implants into the pockets we created under the chest muscle. We do this with our hands. Because the lumen is fully filled, it can be a little tricky to get the implant in place. As you tuck in one side, another will slide out. Can you use your finger to slide the implant into place?
Yeah, I can use my finger to do a lot of stuff. Oh, boy.
Now we adjust the implant with our finger. Great. Let's do the other breast and then we'll check them for evenness.
Okay.
Our patient is still under anesthesia, but we've placed her in an upright seated position. This is so we can inspect the breasts for implant placement and evenness.
I'd love to fucking do that.
We examine the top and bottom of the implants in the breast as well as the placement of the nipples. It looks like the left implant is a little higher than the right. Can you lower it?
Yeah.
Perfect. Now we need to move our patient back to a flat position to prepare to close the incisions. With our patient lying down again, we'll inject some long-lasting numbing medicine into the incisions before closing. And we're ready to close.
Yay, gotta stitch up the boobies. What if it just like the stitches were loose and I just like fucking fell out? You know? What if that happened? Could that happen? I guess it could.
Excellent work. Breast enhancement is typically an outpatient procedure. The patient is released once she has recovered from the anesthetic. The patient is sent home wearing a support or sports bra. Her surgeon will offer additional advices as to when to wear this during recovery. Removable stitches are taken out after about a week. Dissolvable stitches typically disappear. And there we have breast enhancement surgery using silicone implants.
Anyway, thank you for watching.
After a patient's recovery...
Thank you for watching, and don't forget to subscribe for more videos like this. My name is Mr. Hawks Gaming.